Welcome, everyone. My name is Lindsay Goldman, and I'm the CEO of Grantmakers in Aging. Grantmakers in Aging is a national membership organization that serves as a network and resource for funders and a champion for aging-related issues and investments. With over 100 members, GIA works to mobilize the social, intellectual, and financial capital required to improve the experience of aging now and in the future.
Recording in progress.
Today's webinar marks the start of a 4-part series, Innovation and Hope, Building Momentum to Address Alzheimer's Disease and Related Dementias, done in partnership with the Helen Bader Alzheimer's and Healthy Aging Speaker Series. Over the next several months, we will gather the nation's leading thinkers, funders, and implementers to provide an up-to-the-minute, comprehensive look at the community, policy, and scientific responses to this global public health challenge. Thank you to Bader Philanthropies for supporting this important series. Today's webinar will highlight a variety of innovative approaches designed to help improve brain health and reduce disparities experienced by historically underserved populations. Joining us today, we have Sarah Lenz-Locke, the Senior Vice President for Policy at AARP and Executive Director of the Global Council on Brain Health, an independent collaborative of scientists, doctors, and policy experts convened by AARP to provide trusted information on brain health. Lisa McGuire, the lead for the Centers for Disease Control and Prevention's Alzheimer's Disease and Healthy Aging program. Dr. McGuire is a member of the National Alzheimer's Project Act Federal Advisory Council and co-lead for Healthy People 2020-2030 on older adults and dementia, including Alzheimer's. And Stephanie Monroe, the Director of Diversity, Equity, and Inclusion at UsAgainstAlzheimer's, a national advocacy organization based in Washington, D.C. She also directs African Americans Against Alzheimer's, the first national network created specifically to respond to Alzheimer's disease's disparate impact on African Americans. Thank you all for being here. We will be recording today's session, and in the next few days, you will receive an email with the webinar recording along with the presentation slides. We will have a Q&A portion following our panel presentation, and you can submit your questions at any time using the Q&A box. Sarah, I will now turn things over to you. Thanks.
Thank you, Lindsay, for that great introduction. And just to add a little flavor to this, the other speakers that you mentioned, Stephanie Monroe and Lisa McGuire. Lisa McGuire is actually an official liaison to the Global Council on Brain Health, and she and I have been working together now for many years on these issues, so it's a pleasure to appear with her. And Stephanie Monroe, likewise, she and I have worked on many projects. Most recently, she and my colleague David Parks did an ARP webinar on brain health equity, so it's a great pleasure and honor to join Grantmakers in Aging today, especially with my two esteemed colleagues. So thank you for the opportunity. I am pleased to talk to you about what we can do now and the strategies for better health. The opportunity to do this is greatly appreciated because now we are making great strides in understanding the science about better brain health. And we now know that we are going to be able to work together to make a real difference in the public health to people who are living their lives. And this is relevant, of course, to people who are aging, but to all people of all ages, because we hope for them all to live long, healthy lives. Next, please. Most of you are probably familiar with AARP's mission to serve older adults ages 50 and older. But we like to talk about our mission as empowering people to choose how they will live as they age. And of course, there's nothing more important than people's individual brain health, because that is essential to this mission of our organization. If individuals are going to live well as they age, they have to have the maximum capability of promoting their brain health. And I lead a small team at ARP, and our primary goals are to help spark a lifetime of healthier brains and disrupt dementia. Now, you might think that these two things are contradictory, but what I've learned as the Senior Vice President of Policy at AARP, focused on brain health, that the very same interventions that work for people as they age are the same kinds of interventions that help people who already are experiencing cognitive change to lead high quality lives and improve the quality of their lives, even if they should have the diseases that cause dementia. And we put these efforts into three different buckets: prevention, care, and cure. Each are the shorthand for making sure that we're being more accurately talking about reducing risks for cognitive decline, because we cannot prevent all dementias. We are not at the state of science where we can confidently say we can prevent dementia, but we can make significant inroads to reduce those risks. And the image that I would like to leave you with, every time anyone gets into a car, they put a seatbelt on. And it's become common sense, right? It doesn't mean you won't get into an accident, but it will certainly make the accident less severe if you have the sense to buckle up. And so what we're really talking about today is helping people learn how to buckle up for their brain. Two other issues that we're not going to be talking quite as much about, but ARP is also focused on, is optimizing opportunities for people to live with dementia and their caregivers, as well as spark innovations towards a cure. Next slide, please. And if you cannot remember anything from this talk except one thing, what I want you to leave with is that cognitive decline is not inevitable. And that is such a contradictory belief for most people about aging. And as many of us who are working in the field of aging know, longevity brings many opportunities, but it also brings risk. And one of those risks is that dementia rates, which increase because age is the greatest risk factor for dementia. With a growing older population, our rates of dementia are likely to go up if we don't change the trajectory. But that's what we are here to talk about. We do have a way to change the trajectory. Modifiable lifestyle factors can and do reduce dementia risks. And as I shared with my colleagues, and ASA was so generous to allow me to publish, our demographics need not be our destiny when it comes to dementia. Next slide, please. ARP is not in this gambit alone, of course, and we do not pretend to have all of the information. So we have worked with some of the greatest brain health experts all across the world and the United States to distill the evidence into science-based, evidence-based information and reports. And I'll share a little bit more about that. But we are not unique in the United States of having all the good science. And it's been very important to the Global Council that we are in fact global and bringing ideas from everyone, with now over 28 countries who have offered us experts and information, with 150 universities and institutions, including UsAgainstAlzheimer acting as a liaison for one of our reports. And as I mentioned, Lisa at the CDC and her colleagues have been incredibly helpful for every single report that the Global Council has put out. Next slide, please. So the Council has looked at numerous lifestyle factors based on what older adults themselves have told us that they are interested in. We have done surveys to say, what's important to you to know more about when it comes to your brain health? And they've told us over and over again, they want to know what works, but they also want to know what doesn't work. And so you can see that along with things like exercise and diet and sleep, we've addressed things like supplements. 25% of adults older than 65 are spending billions of dollars on health supplements for their brain. And the experts at the Global Council cannot recommend a single supplement unless someone is nutritionally deficient in one of the critical vitamins. They do not recommend any supplement for brain health. And so, as I mentioned, we want to know what works, but we also want to be able to save adults from spending their hard-earned money in ways that are not going to help them. The Lancet study has been often cited by many of our colleagues that modifiable lifestyle factors, and they mentioned 12 specific lifestyle factors, can reduce risk for cognitive decline at the population level by up to 40%. And if the 7 million Americans almost 7 million who are living with Alzheimer's disease now, had received this information at a time where it could have been helpful, imagine the numbers of lives that we could have helped. Even delaying onset of dementia by just 5 years can cut the incidence in half. Next slide, please. So the science is deep and rich, but at AARP, we have specifically tried to boil it down into 6 very manageable recommendations that anybody can choose. And I'll talk a little bit more about them, but I want to make sure that you know right up front that you can get all of the information that I am talking about at the Global Council on Brain Health.org's website. And AARP's efforts at popularizing this and putting tools in the hands of older adults is something that I'm proud to share. StayingSharp.org has a digital platform so that we can scale and reach the solutions that I'm talking about. Next slide, please. We know that behavior change and brain health is important, but it's behavior change that's necessary. Many adults already believe that brain health is important, but only about 56% of people, a little bit more than half, say they are doing the most important activities to support brain health, which was exercising and diet. And I can tell you that these are the people who say they're doing it, who are actually doing the recommended amount, so it's much lower. Next slide, please. So our report, How to Sustain Brain Healthy Behaviors, was just released on March 15th. And today we're proud to announce that this has been translated into Spanish. We have social media and other infographics available to people to share. And we hope that you will take a look at them, adopt them, and use them in any way that you find useful. But the key now is, how do we get people to actually sustain healthy behaviors now that we've spent so much time and effort telling them what actually works? Next slide. The key to the recommendations are that it has to be a triple approach. We can't simply put the research findings out and expect individuals to adopt them. We have to work with communities, aging advocates, providers, employers, other nonprofits, and the private commercial sector to get people to make it as easy as possible for people to implement these recommendations and to sustain them. And finally, looking to systemic changes to have policymakers create the opportunity across the board in an equitable way. And I know that we'll be talking about brain health equity quite a bit, but it's policymakers who have the opportunity to make this possible for large swaths of our community. The report goes into knowledge, motivation, and confidence that is absolutely necessary for all 3 key audiences to implement. Next slide. Now, I know that I only have about 1 or 2 minutes left to go through a quite ambitious slide deck, so I'm going to fly through. But here is our one-page infographic that gives people the heart of what the recommendations are, positive behaviors to choose, and on the right-hand side, tips for individuals to adopt them. Next slide, please. You can see that this is a long list of the specific recommendations we have set for communities to take. And the next slide, please, is what policy recommendations that we are asking policymakers to pay attention to. Next slide. The infographics are available in Spanish, French, Chinese, and Arabic, and the report itself is now fully available in Spanish. And we have short animations coming soon, which will be available on our website. Next slide. Brain health equity, and both of my colleagues, I'm sure, will talk in great depth. We know that dementia does not affect all groups equally. And in fact, our most vulnerable communities, for example, women, 2/3 of people who get dementia are women, and it's not entirely explained by the fact that women live longer. And women are 2/3 of the caregivers for people living with dementia. It is the social determinants of health that we believe make such a huge difference, not only for women, but rural communities, retirees, African Americans, and Hispanics. And getting at these social determinants of health and really engaging these communities through outreach and engagement is critical. Next slide, please. Here's an example of each of the substantive reports. Our latest one before behavior change were 2 reports related to COVID, and I hope you take a look at them. We have this Boosters for Joy, which is available to help people even in this current situation of COVID maintain their social connectedness, plus get information about brain health. Next slide. Thank you very much. I encourage you to reach out to me. I would love the opportunity to talk with you all at greater length. There's my email, and there is my Twitter email address. I've just put the policymaker animation up on Twitter, and I hope you'll check it out. Thank you. Back to you, Lindsay. Actually, I think I will just hand it over to my good friend and colleague, Lisa McGuire.
Thank you very much, Sarah. What an exciting presentation to kick us off. And so I'm going to pick up on several of the themes that Sarah mentioned, and I think also tee up a few of the themes that Stephanie is going to talk about in the last presentation. Next slide, please. So I'm going to talk first from a grant makers perspective of some of the types of frameworks and initiatives that we have in CDC. And then we're going to hear from Stephanie and the exciting work that she and her organization are doing, partially with some CDC funding. So one of the things that CDC does is CDC has the Healthy Brain Initiative. And the whole purpose of that Healthy Brain Initiative is to really advance brain health. And we mean brain health as broadly as you can conceptualize it as part of a public health practice. And we think about that nationally. And we award 2 different types or 2 components of that, which I'll talk about in a second. But the next slide. The main activities of the Healthy Brain Initiative is really to identify those strategies that are going to promote brain health, address dementia, and help support caregivers. So what we do every 5 years is we develop our roadmap. So the nice woman looking here off with purpose, the second roadmap from the right, that is our most recent roadmap for state and local public health professionals. What it does is it identified 25 key actions that the public health field needed to move forward to help improve the life, health, and well-being of people with Alzheimer's disease and related dementias, as well as their caregivers. Our roadmaps are developed consistent with the essential services of public health. So you can see the wheel up here on the right-hand side. That shows 4 of the 10 essential services of public health, as well as some of the other key concepts that we believe works through our work, such as leveraging resources, eliminating health disparities, and collaboration. Because we know as public health, to really accomplish anything, we need to do that through collaboration. When we were revising our roadmap that I just pointed you towards, we really were looking at some of our evaluation data. And one of the places that we noticed that we weren't seeing a lot of use of our roadmaps was in tribal communities. So we took a good look at the roadmap and the actions that we had developed for tribal communities. And we realized that they weren't as applicable to tribal communities as we had hoped they were. So we stepped back, took a good 6 to 9 month consultative process with tribal communities, a lot of leaders, federal partners as well, and really revised or created a new roadmap that is designed exclusively for tribal communities, which is the roadmap on the right that you see listed here. Next slide, please. So I mentioned the Healthy Brain Initiative and that we funded 2 different components. And this is for work, as I mentioned, at the national level. So component A really is a national organization with national scope that reaches within states that can help develop and implement strategies that we see identified in that Healthy Brain Initiative Roadmap series. This group is also responsible for revising and updating that roadmap series. The awardee of that is the Alzheimer's Association. The component B, this was designed to support groups or populations that work with populations that have the highest burden of Alzheimer's disease and related dementias. And you can see here, we funded International Association of Indigenous Aging, or IA Square, for American Indian Alaska Native adults. We funded the University of Illinois at Chicago, or UIC, who works with adults that have intellectual and developmental disabilities. And the ambitious group, Us Against Alzheimer's, came in with a phenomenal application to work with 2 populations, the Hispanic and Latino population, as well as the African American population. And we're going to hear the really cool things that Stephanie and Us Against Alzheimer's are doing in just a minute. Next slide, please. So another activity that we have at CDC is BOLD. And what BOLD is BOLD is the shorthand term for building our largest dementia infrastructure. So the whole purpose of BOLD is to create a uniform infrastructure for public health across the US. And that uniform infrastructure was designed to implement CDC's Healthy Brain Initiative Roadmap series. The legislation calls forth that CDC funds public health centers of excellence, which I'll show you in a second, that we also provide funding for public health departments across the country who are out there working and truly building that infrastructure. And then the third component of BOLD is to increase data analysis and timely reporting of that data that can be used for action. Next slide, please. The priority areas in BOLD are looking to create that urgent population level change, looking at things such early detection and diagnosis of Alzheimer's, preventable hospitalizations for people who are diagnosed with Alzheimer's or related dementias, managing their other comorbidities or chronic health conditions so they themselves don't find themselves hospitalized for something that could have been preventable, either through an immunization or managing some other chronic health condition. Another priority for us is care planning and management of people who are diagnosed and as they go through the disease process, as well as support for caregivers. We do pay close attention and special attention to health disparities, and that includes social determinants of health, focusing also on rural areas because we know that rural areas aren't necessarily the same as metropolitan areas, and not all rural areas are the same as other rural areas, as well as specific segments of our population that have high burden of Alzheimer's and related dementia. Next slide, please. So here's our two components of BOLD that are supported by CDC. So once again, BOLD's purpose is to create that strong and uniform public health infrastructure. Next slide, please. So our BOLD Public Health Centers of Excellence, these are 3 centers of excellence that are funded to work in the orange topic areas that you see identified here. We awarded 3 public health centers of excellence who are working on 5-year awards. So the University of Minnesota is working on dementia caregiving. They are hosting their first national meeting in June on caregiving in Minnesota. The Alzheimer's Association was funded for dementia risk reduction. They're hosting a social determinants of health and Alzheimer's disease and related dementia at AAIC, or the Alzheimer's Association International Conference, this July in San Diego, which is free and open to the public, just as the University of Minnesota's meeting is free and open to the public. And then the New York School of Medicine, our BOLD Center of Excellence on Early Detection of Dementia. They're also hosting their first conference, and it will be this fall, and it will be virtual. So if you're interested in information on any of those events, please reach out to me. And those awardees are doing much, much more than just hosting meetings. Next slide, please. So our BOLD programs. So one of the things that BOLD is doing is getting that uniform infrastructure. And the way that we do that is we are charged to fund states, political subdivisions of states, tribes, or tribal organizations with CDC's BOLD funding. You can see here that we funded 23 of those groups, and they were funded either at the enhanced level or the core level. Those that are funded at the core level, they are developing an Alzheimer's action plan and working with their coalition and building partnerships to get a plan that they are all have buy-in for and approved by their jurisdictional leadership. Whereas the enhanced recipients, they already had a plan in place, and they're working and spending their 3 years of implementing that plan across their jurisdiction. Next slide, please. So here's how the pieces fit together. So at CDC, we've had to be very strategic for the past, we've always had to be very strategic with our funding to really make sure what we are doing is as impactful as it can be. So we see all 4 of these different award mechanisms working together, not necessarily any one of us helping them get toward those long-term outcomes, but each of them together collectively is getting us closer and closer to what our long-term goals are, which is really trying to increase diagnosis and awareness of ADRD, encouraging people who are experiencing changes in their memory performance to talk with their healthcare provider, to reduce those preventable hospitalizations of people who do have a diagnosis, and also to make sure that people are utilizing Medicare benefits that are available, such as annual wellness visits and care planning visits that may cover some of the screens and services to help them stay as healthy and independent as long as possible. I want to share one more thing with you from the next slide, please, of some exciting things that are going on at the national level. So Sarah talked about AARP's efforts to make sure that people stay healthy and to make sure that we engage in behavioral change. What I want to share with you here is some information about the National Alzheimer's Plan. So the National Alzheimer's Plan, the NAPA, or the National Alzheimer's Plan Act, was signed into law in 2011. And it set out 5 extremely ambitious goals that you see listed here. Since 2011, there had not been any goals added to the National Alzheimer's Plan. Next slide, please. However, in December of 2021, the Health and Human Service, the Secretary Becerra of Health and Human Services and federal partners really thought about this. They charged a committee with exploring the possibility and the feasibility of adding a goal on risk reduction. And Secretary Becerra chose to include this in the 2021 update of the national plan. Next slide. So you can see here at the very bottom, goal 6. Goal 6 talks about not just reducing your risk of Alzheimer's disease, but it talks about accelerating action to promote healthy aging and to reduce the risk of Alzheimer's disease and related dementias. We know scientifically, and some of the work that Sarah pointed out to us in her presentation, is many of these type of activities that a person might engage in, such as diet or exercise or maintaining their blood pressure and other things they're doing to keep their body healthy, it will not only help keep their mind healthy, but it's really helping the entire body and that person age more healthily. So we're very excited to see that this goal was added. Now, one thing I want to point out that this is, you can see here that this language in the slide uses the term risk reduction. So we use the term risk reduction because prevention implies that if we do something like get a certain vaccine, we're going to prevent that disease. Versus like getting in a car, as Sarah mentioned, and putting your seatbelt on, that's reducing your risk of severe injury within the car. It's not going to prevent you from an injury, but it's going to reduce the likelihood or reduce the risk. It's a subtlety, but with the science within the space of Alzheimer's disease, we're learning so much each and every day with the investments that have been made into research. And so with the knowledge that we have already, the National Advisory Council felt very comfortable going forward with adding a goal about reducing your risk, because the kinds of things people do to reduce their risk is helping them live healthy lives as well too. Next slide, please. So some of the purposes of that goal 6 is helping to prioritize healthy aging. We know that that's extremely important when we talk about management. So with Alzheimer's disease, we might be delaying, or we might be actually preventing the disease or slowing the progress of the disease with that. Also with goal 6 is we are building some infrastructure where we can quickly identify some of those risk reduction interventions and translate them within existing public health systems or within existing healthcare systems as well. The other thing that's so important with this goal 6 is really to focus on the inequities of dementia, especially the burden that's placed on Black and Latino communities. We really have got to address those risk factors that lead to higher prevalence of dementias in these communities, as well as some of these same risk factors and social determinants of health lead to higher negative health consequences with these communities as well. Next slide, please. So I want to thank you very much today for inviting me to share the work that we're doing at CDC. And now we're going to hear from Stephanie Monroe from UsAgainstAlzheimer, who is going to share with us some of the great work that she and UsAgainstAlzheimer's Disease is doing.
Thanks, Lisa. So I get to wrap everything up and bring us all in for a landing here. I'm very happy to be part of this exciting presentation. I'm going to probably take us back up to the top a little bit in terms of understanding why it's imperative for us to be taking action, strong action against Alzheimer's disease at this moment in time. I've purposely titled this Addressing Equity, Early Detection. Now I'm a little bit ashamed for saying prevention, but we'll talk about prevention and risk reduction and inclusive research. Notice that equity is at the top of this because we understand that, and then you'll quickly see that Alzheimer's disease does impact historically underserved populations differently, more significantly, and that part of equity means giving communities what they actually need to address a disparity, which may mean more and different types of attention that we would be providing to majority population. That we can't really solve any of these issues unless we address equity issues in our nation, which affect not only the the current populations, but generations to come. So that's been our focus. Next slide, please. And you can actually go another one. So Alzheimer's disease, and I think this is really important to understand that of the 10 leading causes of death, Alzheimer's disease is the only leading cause of death that's still on the rise. That to me is a very disturbing statistic. When we first started working in this space, Alzheimer's disease in terms of research was being funded around $400 million, although it was presenting about a $17 billion problem in terms of overall cost on families, burden, caregiving costs, and costs on the medical system. And our founder once said that if you had a $17 billion problem and you provided a $400 million solution to that, you would likely be fired. And so one of the first things that we began to work on is how do we get these research numbers to really reflect the imperative for us to be able to address and adequately understand the causes and the potential of different strategies and theories about how we can hopefully one day cure, but certainly better treat Alzheimer's disease. So it still is the only leading cause of death that's on the rise, but I feel like we're making excellent headway now that we have approached the $3 billion funding amount, and we see research and other really effective strategies that have occurred in the last 10 years as a result of those efforts. Next slide. By 2030, nearly 40% of Americans living with Alzheimer's will be African American or Latino. And that's a startling number. We also know that as we continue as a nation to brown and age, that this 40% number in terms of an overall demographic is going to become a very large number, with the prospect that 1 in every 2 people over the age of 85 will be walking the streets of America, potentially with a form of dementia. Next slide, please. We have 6.2 million Americans currently with Alzheimer's disease, and about 20% of them are African Americans, which is really important since we're only about 13% of the population. Alzheimer's is the 6th leading cause of death for all Americans, but it's the 4th leading cause of death for African Americans. We have over 16 million Americans providing 18.6 billion hours of unpaid care for people living with Alzheimer's. It's valued at about $244 billion. And one of the things that we've seen very clearly through COVID and people exiting the workforce is that the lack of caregiver resources for families really made a difference. We did spend, our organization spent time trying to equalize a narrative that was portrayed about the importance of parents having the ability to spend time with their children, whose schools and daycares were closed because of COVID. But we really wanted Congress to additionally focus on the fact that people who are taking care of their loved ones who are older and where their adult day centers were closed, where their caregivers were closed, really forced a lot of people, including a lot of women, out of the workplace. We need to consider both people from cradle to the end of the life spectrum in terms of being able to provide adequate family care supports for them. Next slide. So African Americans, as I mentioned a second ago, are about 13% of the population. We did a cost report as one of the first things that the African American Network launched, and then was soon followed by the our Latino network, where we found that over 33% of the nation's cost attributed to Alzheimer's disease was being borne by African Americans, again, only being 13% of the population. So we begin to see this picture of an emerging disparity. The economic burden on African Americans, even looking back as far as 2012, was over $71.6 billion. As was previously mentioned, more than 60% of these costs are being borne by women and their families, who also tend to be about 70% of those who actually have Alzheimer's disease itself. We see continuing both through COVID and currently that African Americans between the ages of 40 and 64, and that's before you would generally see Alzheimer's or dementia, those are the people who are taking care of their loved ones. They're having to step out of the workplace much earlier in life, reduce their hours, and in fact, many times just quit altogether, they're losing about $6 billion in labor market productivity due to Alzheimer's, which is mostly from lost wages. So we're seeing not only a family crisis of Alzheimer's, but an economic crisis of Alzheimer's disease and its impact on our nation's GNP. Next slide, please. And this slide just shows us what the projected growth in Alzheimer's looks like, with the blue line being the projected growth for Latinos, and the yellow line, the projected growth for African Americans. We see that it's a pretty significant increase that's expected through 2050 and beyond, unless we can find a way to modify the risk, find disease-modifying treatments and a cure for this disease. This is where we're going to end. Next slide, please. And most of these costs are being borne by, again, out-of-pocket costs that families are bearing themselves. As I said, we did do a couple of cost reports. We're hoping to be able to update those cost reports that were first produced in 2013 and I believe 2015. We unfortunately expect to see the projection of the impact on families being higher as we see more people moving into advanced stages of Alzheimer's without having an effective disease-modifying treatment or cure. And I'm sure that many of you have seen what has happened of late with a hopeful drug that was approved by the FDA, but CMS made a decision not to fund it, both because, and we'll talk about this a little bit later, of the lack of inclusion in the trial that led to the drug itself being approved, but also secondly, a question about whether there was clinical meaningfulness in the changes that people were seeing. So without having that type of a drug or potentially other drugs that are following that same pathway, this is what the cost of Alzheimer's disease look like, where the bulk of these costs are caregiving costs for individuals and productivity costs being a smaller cost, but that obviously impacts families who are much younger. And again, you're having to choose between caregiving for your loved one, putting your kids through college, and as this is impacting minority populations to a higher degree, it's very difficult. Nursing home and adult care is in the red. And since we don't have a national sort of long-term care policy, that's an issue that, again, we need to really begin to focus on because of its impact on families. And then the medical cost is the blue on the bottom. That becomes increasingly significant as people end up with comorbidities that may be cited as the cause of death. And the impact, though, on Alzheimer's and affecting people's ability to survive those comorbidities, to adhere to medical regimens and things of that nature, that's what's driving a lot of these overall costs. It's important for us as a nation to make sure that we address all of these. Next slide, please. I'm going to speed up a little bit. The economic impact on Latinos is similar to what we've talked about. Next slide. 30 billion, sorry, in 2030. And next slide, about 105 billion projected in 2060. Next slide, please. So we've talked about, and we can talk about this slide on the next slide, where we're seeing these health disparities that exist among African Americans, Latinos, who are more likely to have a stroke, to be obese, more likely to die from heart disease, and significantly more likely to be diabetic. All of these are contributing factors to Alzheimer's prevalence that we see, and all of them, we need to be addressing when we're talking about these types of dementias. You can skip 2 slides. One more. We talked about social determinants of health. We've mentioned those, and we did some research looking at place, and with the Urban Institute issued a report called Place Matters. And we actually found that a person's zip code may actually be a better predictor of a person's likelihood of developing Alzheimer's disease than their genetic code. There are deep inequities in social determinants of health that exist in those counties that are most highly impacted by Alzheimer's. Similarly, we see lower impacts in counties that have, for example, higher median income, lower numbers of poverty, better take-up rate on health insurance, and higher education. Next slide. And then you can go ahead one more. Thanks. So zipping ahead to some of the barriers that we've detected, and please feel free to reach out to me, but I'm going to gloss over some of this because there's a lot to cover. So some of the work that Us Against Alzheimer's has done is sort of listed here. We have worked hard to, with our CDC grant, we're working to enlist the support of nurses throughout the country through a nurse fellowship program to help them as the most trusted provider of health services and those voices in the communities to both begin talking about brain health, but also having cultural and crucial conversations in their communities about what the communities can do to be able to address those issues. We need better screening of and earlier screening and assessment tools. And we've developed at Us Against Alzheimer's a tool called the Brain Guide, which is something that families can take advantage of in their own homes, online or by phone, and see where they are and then be connected to important resources to help them address some of what they're seeing. We work with industry and NIA and other partners in terms of identifying opportunities that could be leveraged to allow these communities to better engage in research, because we know that not all medicines work the same in all populations. Inclusion is really important. Unfortunately, in Alzheimer's and other types of trials, we sometimes see 5% on average of minority populations engaged in clinical research, which means that about 95% are white and frankly European men who are engaged in those trials, and that really is not acceptable. Next slide. We've already talked about a little bit how important it is to do prevention work and risk modification work. The wonderful thing that's very hopeful about this is that we know that Alzheimer's changes in the brain can often begin about 20 years before the first signs are shown. So we've got this wonderful window where risk modification and where social determinants of health intervention, we believe, could really change the course of Alzheimer's disease for many communities before there would be a diagnosis of AD. Next slide. Brain Guide is what I've spoken about before. If you want to see how this tool works that we've developed at Us Against Alzheimer's, you can visit the site at www.mybrainguide.org. Again, it's in Spanish. You can take these series of questions for yourself or on behalf of a loved one. It gives you a good snapshot of sort of where you are and then connects you to resources in terms of what your next steps would be. People often say that doctors don't really have the time to do screenings or really talk about this. We want, as an organization, to work toward normalizing brain health so that it's part of the checkup from the neck up that you should be getting when you go in for at least your annual wellness visit. We'd like to see that moved again about 20, 30 years before that, so people can begin to think about their brain health in the same way that they think about protecting their cognitive health and their heart health. Next slide, please. So with that, I want to say thank you for your attention and look forward to your questions, and turning over now to Lindsay.
Thank you so much. Now we'll turn to our Q&A portion. So if all of our speakers could put their cameras back on. Great. So our first question is for Lisa. And the question is, recognizing the considerable investment that CDC has made in the BOLD strategy, looking at the National Alzheimer's Plan, where's there opportunity for other funders to complement the investments that you've made and potentially leverage that CDC funding to improve outcomes related to risk reduction? And it'd be great if you could, answer the question for, the funder who has $10,000 and then for the funder who has, much higher capacity, because I think, our membership is diverse. And so we'd love to hear where those opportunities are.
Wow, where to begin? There is so much need as related to Alzheimer's disease and related dementias. I think you've heard from all three of the speakers today we all are doing a lot, but it really takes a lot more than just us three dynamic ladies to solve this issue. I think, especially for the smaller grant makers, I think really kind of thinking about your local public health. Most public health is local. And the advantage with public health is public health uses existing policies, systems, and environments. It might be doing a small educational or informational campaign in your local area. It could be doing something even bigger if you have bigger funding. It could be looking at, doing that informational campaign in your state, in your county. If I'm kind of going up, and then across the nation. We know different messages resonate with different people. If doing some message testing, seeing what words resonate best with people. Some people don't like to hear the word brain health. Some people, different communities, don't like the word dementia. Some people engage in healthy behaviors because it helps their brain, but they may not engage in them because it helps their heart. So it's really a tough nut to crack, I guess, so to speak. But there's lots and lots of opportunities through communication campaigns, educational campaigns. These can be very public focused. These could be provider focused. But I would encourage you to look at whatever the latest science or information is, and or consult with us, and we'd be glad to help.
Thank you. Related to something that you've just said about different words resonating with different people, and this question is for the panel. Can you talk a little bit about stigma? Because there's still a tremendous stigma associated with dementia and cognitive decline. And I wonder, the extent to which that plays into challenges in reducing risk. So how are you addressing stigma, and is there a role for philanthropy to help move the needle there?
I'll start and then let our colleagues go. Stigma is huge, 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 huge. I'm on a national committee that's looking at these words and the terms and what they mean in different cultures. But, we hear anecdotal stories that someone will say, oh, I was just diagnosed with dementia. Thank goodness. I'm glad it wasn't Alzheimer's. But, people fear dementia or Alzheimer's more than they fear crime, violent crime. And, we need to think through that, because that's some of the hesitancy of people to go see their doctor and talk about changes in their cognition. That's also hesitancy from the provider's perspective sometimes to give that diagnosis, which can lead to help and resources that family unit might need. I'll pause and let my colleagues say good things.
Well, I would add certainly stigma and the lack of trust is a big area of issue within the African American community. And, part of that is, the way that our communities somehow view mental health in general. And so there are stigmas attached. Oftentimes Black communities will go to church on Sunday and the pastor begins with, thank God we're all of our right mind. So there's this stigma that's attached to, if you're not quite of your right mind, then maybe you did something, that blame the victim. But also I think the fact that we have great treatments to treat certain symptoms, but we don't have a disease modifying treatment. Physicians don't want to tell a person you have this life-ending disease that may bankrupt your family and there's nothing really you can do about it, and we don't have a treatment for it. So I think investing, we know that we need earlier diagnosis when the treatments are most effective. And a lot of times in the Black community, they go in so late, in your 80s, and you've already had, again, this disease percolating in your brain for probably 20 years. The medicines aren't going to be as effective. So getting earlier diagnosis, bringing Alzheimer's more out of the shadows. And I'm very thankful that we see programs like This Is Us and The Walk and other things that people relate to through television and people talking about it. I think we have definitely made significant progress in the last 10 years. As we bring more opportunities for treatments that are effective, I think people will be more willing to raise their hand and say, hey, I've got this. This is the disease, help me.
So I'm excited that you asked that question, Lindsay, because the issue of stigma, as both of my colleagues have said, is hindering a lot of progress in this field. So we have at ARP have recently completed a nationally representative survey where we have looked at the question of stigma and realized that it permeates all parts of society. And in some instances, what's surprising is that the younger you are, the more stigma you hold. And healthcare providers, even though that they report that they understand that there are healthy lifestyle factors that you can implement, almost 25% are not talking to their patients about it for some of the reasons that Stephanie mentioned, plus not having any sense that there's something you can do about it. So the reason I began my talk with the conversation that cognitive decline is not inevitable is that people fundamentally think it is. People believe that there's nothing you can do. And if you start from the premise that there's nothing you can do about a problem, then you're not going to solve it. You're not going to try to use your own agency or come together with others to make a difference. And so one of the things that we realize is that we have to build a long-term communication strategy, and ARP is not able to do it by ourselves. We have tremendous resources that we are committed to using, but we know that this is not a conversation that only older people can have with older people. This has to be a collective effort of all of us to make a difference. And so we're building a collaboration specifically to get at how do we break the stigma. Now, we're not going to call it a stigma campaign, and instead we're going to call it a movement, but we're building it now, and we would love all of your input and your collaboration into how to make that successful. We have to do something along the lines that, for example, Finland worked on for 20 years to get salt out of the diet. They incorporated every part of society. And by their campaign, they were able to reduce the incidence of stroke by 80% in their population. And this was done in combination with their public health department, with their private sector, with their public sector. If we work together, we can make a huge difference. And so I would ask the foundations that are here, the thought leaders, to join with us in this collaborative effort. And let's make sure we're having the right people talk to the right community at the right time. One of the last things I want to say here is Dementia Friendly America is spreading all over the United States. It is a community-based effort, a grassroots effort run by my colleagues collectively at N4A, now called UsAgainstAlzheimer. And there are so many members of the public who want to make a difference in their communities for people living with dementia and to prevent cognitive decline. But they don't know and they don't have the resources to do it. So if you have small resources, I guarantee you we can find small groups within communities that you want to serve who are desperately looking for funding to implement programs. And we have worked to develop an evaluation for Dementia Friendly America so that programs we can prove whether it works or not. And so we have a roadmap for those evaluations, and we would love help in getting them evaluated so we know what works and we can save money in the long run by only replicating successful experiments.
Thank you so much, Sarah, for that very inspiring call to action. We look forward to working with you, and we will stay in touch. So thank you to Sarah Lenslock, Lisa McGuire, and Stephanie Monroe for being with us today. Thank you to Bader Philanthropies for supporting this series. As a reminder, we will be making the presentation available to anyone who wants later, including slides and audio. So watch for an email to be sent within a few days. Please join us for our next webinar, May 26th at 1 o'clock, Conveying Empathy from a Distance, using e-empathy in Goals of Care Conversations. Please follow us on social media and please complete the brief survey that you'll soon receive to help us improve our programming. Thank you all for participating today, and please be well.